Working in a smaller community, everything's just a little bit slower pace. You can sit outside and listen to the birds with the cool breeze. It's just a more relaxed lifestyle, so I find that translates into the patients when they come to see you as well. Being a physician in a small community allows me to feel a greater sense of job satisfaction. I'm not sure a day goes by where I don't feel like really appreciated by the patients that I see in my practice or that I see in the emergency department or the hospital.
Creating a good rapport with the doctor in any situation is extremely important. There are people who should get to know you. Although I have access to emails and on-call emerge doctors in London, there's nothing like having one that's close. Any doctor who saves your kid's life is going to play a different role. And in our situation, she hasn't just excelled in the way she takes care of Olivia, it's how she takes care of all of us as a family. She's somebody that I know I can turn to at any time and she'd be there 100%. And not just because she's a doctor or our doctor, but because she genuinely cares and has a passion for the well-being of people.
They were so appreciative that their physician that knows them very well was able to be there to care for them and able to sit and spend time with them. And I think that's something unique that we get to experience in a smaller community.
Our doctors are resourceful. I know that ours is resourceful, and she can find ways to help even in a small town. A big piece of it is the doctors coming up here, learning the resources that we do have, because we do have a lot of options. It's just getting to know where they are.
My working environment is exactly what I want it to be. For me, I knew I wanted to do a little bit of everything, and here I'm definitely able to do that, where I have a practice, I work in the emergency room, I see inpatients at the hospital, I do palliative care at our hospice. It is really unique living and working in a smaller place because we get to use all the skills that we learned while we're in our training. It does make a big difference what the physician group is like. We have a smaller core of newer, younger grads who get along really well, and we interact with each other socially. There's also some physicians who are a little bit more experienced, been in practice a little bit longer, and they're always so willing to offer advice or help or answer any questions that we have. Also at our hospital, we have a fantastic group of nurses who are so kind and caring and compassionate, and that makes a big difference too. It is very important to have good people around you to lean on for support. When I contacted the physician recruiter in Kincardine, she was very helpful in connecting my wife with multiple different employment opportunities. Even before I had agreed to sign on here, she had already had multiple job interviews, and she ended up getting hired for a job before I had even signed on to work in Kincardine. I'm very happy with my practice. My wife is very happy with her job, and she's actually pregnant now, so an excellent place to raise a family. There's so many young families with young children here. They really like the area, and it's almost like a little hidden secret out here and that no one really knows about. I'm going to be quite happy here for the long term.